welcome. My name is Dr. Calliope, and I am going to be performing your neurological assessment today. How are you doing today? Okay, a little nervous. Yeah, it's gonna take a little bit of time for this test, but I assure you there is nothing that should be uncomfortable or painful at all, and if it is, you can let me know and we can stop the examination, okay? It's very low stakes. I've got an absolute wide array of things for you today, okay? All right. It's almost like we're going to be playing some games, really, at least for the start of the examination. Okay, so let's see. Would you mind just confirming your name and date of birth for me? Excellent. And is that the name you prefer to go by? Okay, and how do you like to be addressed? Excellent. So to start out with, I'm going to be asking you some questions that pertain to your neurological condition, okay? So, have you had any history of the following symptoms that I'll list off? Headaches, okay? Pain, pretty much a no-brainer, right? Weakness, like muscle weakness, okay? Poor coordination, diminished or abnormal sensations, okay? Fainting, confusion, and any issues with your memory at all, short term, long term, anything like that. Okay, very good. So now we're going to get into our mental status testing, all right? So first, if you could just please tell me the current date. Okay. Very good. And where are we right now? Very good. Okay. And who is the state governor currently? Okay. Now, I'm going to have you repeat a short list of items back to me, okay? Star, square, circle, rectangle. Could you please repeat those back to me? Very good. Okay, so we're going to test a little bit of recall, okay? So I'm going to give you a list of 3 objects, and I want you to keep that in your mind. I will ask you later on in the testing what that list was, okay? We're testing your memory a little bit. Green, hat, couch. Okay, what were those items? Okay, I want you to remember those, all right? Would you mind just describing a recent event for me within the last day or two in your life? Could be what you had for breakfast yesterday, or if you went out to do some errands the day before that. Just an event that shows me that your recent memory is working. Okay. Okay. Okay, very good. Now, would you mind describing an event for me in the distant past? Perhaps if you went on a vacation as a child, or you had a school field trip, something that has occurred years ago so that we can test your distant memory, your long-term memory. Okay. Very good. And approximately what year was that, or what age were you? Okay, very good. All right. So I want to test your abstract thinking a little bit. So I'm going to have you interpret a proverb for me, okay? So if you would mind just explaining to me what you think the phrase, "a rolling stone gathers no moss," means. Okay. Okay. Okay, very good. Now I'm going to do a tiny little history test with you real quick. If you wouldn't mind just naming the last 5 presidents to the best of your memory and tell me what the state capital is. Okay. Right, and the state capital, very good. Very good. Yeah, the president question is a little tough sometimes. I don't believe I've even lived through 5 presidents, so that one can be a little tricky. All right, so if you recall, I asked you to remember a list of 3 objects a few minutes ago. What was that little list? Okay, green, hat, couch. Very good. Okay, so recall is good. So how is your mood today, and how would you consider that lately, like within the last few weeks or so? Okay. Yeah, the cloudy days so far haven't been fantastic, right? Are you excited for the holidays at all? Do you celebrate? Okay. All right. Okay. Very good. All right. So now I'm going to have you follow a simple command for me. It's going to test your ability to both follow a command and also differentiate between right and left, okay? So if you could just put your right thumb over your left ear and stick out your tongue for me. Okay? Right thumb over your left ear and stick out your tongue. Yeah, I can give you a moment. That's kind of a tricky one. You have to digest it in a second. So, right thumb, left ear, and stick out your tongue. Just like that. Yep. Very good. So now I'm going to have you name some objects for me, okay? So first, what do I have hanging on the wall back there? Yeah, painting, picture, that works, yeah. And what color can you see at the bottom, at the corner of that painting? Orange, good. And what about the little flash of color on the bottom of the other painting? Green, good. Okay, and what is this? What is this? Ball, good. And what is this? Yep, the Sharpie marker. Okay, and what about this? Okay, it's a pen. Very good. So you can identify objects easily enough. Okay, now I'm going to have you name certain body parts, okay? So what is this part right here? Nose. And what about this? Eye. And this. Ear. This. Hand. This. Finger. These. Shoulders. Okay. And what about this? Elbow. Very good. Okay, now we're gonna do a little bit of testing with a sheet right here. So what I'm gonna have you do is I want you to read each phrase. I want you to say it aloud. I'm gonna have you write it out, okay? First, this phrase. What does this say? Okay, let's move down to this one. Read it and then tell me what it says. And the last phrase, if you could just read that and say it aloud for me. Very good. And now I'm going to clip it to my clipboard, and I want you to just write what this says. I'll give you my pen. If you could just write this out for me. Very good. That is perfect. Let me just note that down. Okay. Now I'm going to have you hold out your hand for me. Okay? And then I'm going to have you close your eyes. I'm going to put an object into your hand, and I want you to just feel it in your hand and tell me what you think it is, okay? Alright, so keep your eyes closed, and I'm just going to put an object in your hand. You can take a moment to feel that object. Okay, and what is that object? Very good. It's a ball. And what about this? If I put that in your hand, what does that feel like? Okay, what is that object? Good. It's a pen or a marker. It's a little thick to be a pen, but I would take that too. And last object. Keep your eyes closed and feel the object in your hand. Play with it. See what it is. Okay, and what is that object? Very good. Rubber band or a hair tie. Especially if you feel it like that, you can feel the elasticity. Very good. Very good. Okay, so now I'm going to have you keep your hand out and keep your eyes closed, and I'm just going to trace numbers on your palm. I want you to let me know what number it is that I've traced on your hand, okay? Eight. Very good. All right, so now we're gonna have you hold out your hands again, but this time both hands, and we'll have you close your eyes. So I want you to tell me if you feel touch in one place or two places at the same time, okay? So for example, if I have one finger on your hand and one on your arm, that's two places. I have one finger on your finger, and that's one place, okay? So you just let me know either one or two, okay? One or two places. Very good. Okay. All right. We're getting closer to the end of our mental status examination, okay? So now I'm going to have you open your eyes, and I want you to copy different finger positions that I show you, okay? Not going to be throwing up gang signs or anything like that. It'll be simple, okay? I just want you to be able to show me that you understand and can copy different commands, okay? All right, so hold up your finger like that. Okay, what about this? All right, 3. Okay, what about this? And can you steeple your fingers? Okay, can you make a square? And what about a triangle? Just like that. Okay, what about a giant circle? Can you make a giant circle? Very good. And can you splay all your fingers? Very good. Okay. All right. So I'm going to grab a piece of paper again, and I'm going to hand you my pen, and we're going to do a little drawing, okay? I want you to please draw for me a house, okay? It doesn't have to be anything special, just two-dimensional, but I want you to go ahead and draw me a house, okay? Very good. Okay, very good. So we've even got a couple windows, a doorknob, and a sun. That looks very nice. Very artistic. Okay. Alright, so I'm gonna have you do something for me here. So I have a little box of matches here, envelope, whatever you want to call it. And I want you to take one of these matches and strike it, okay? I have a little bowl here that you can use to put it out in so that nothing catches fire. That would be a little bit awkward for our examination. Now, I don't want you to get too caught up with actually lighting it on fire. These can be a little tricky. I just want to know that you understand and can perform a simple command, okay? So I'm going to give you this. And if you just want to grab one of the matches. Okay. And yeah, it just flips over like that. And strike it. Very good. Okay. I'm going to blow that out for you. Alright, and I can have that. We can put that in the bowl. There we go. So, first try. That's pretty nice. Usually takes people 2 or 3 tries, but that's really good. So, now it smells a bit like a campfire in here, but I think that's probably preferable than the normal sterilized scent of hospitals. Okay. And finally, I'm going to have you do some math with me, all right? So I'm going to have you look at the math problem we have written out and tell me the answer. It's very simple, don't worry. It's quite elementary. 1 plus 1. What is the answer to 1 plus 1? Okay. 2 plus 3. What is the answer to that? 4 plus 5. What is the answer to that problem? Good. 10 plus 20. What is the answer to that problem? Okay. 45 plus 5. What is the answer to that problem? Okay. And 16 plus 4. What is the answer to that math problem? Very good. Okay. All right, so we've completed our mental status testing, okay? So now we'll move on to the next part of our neurological assessment. Okay, so now we are going to be testing all 12 of your cranial nerves, okay? So, we're going to start with nerve number 1, your olfactory nerve. So, I'm going to have you close your eyes for me, and if you could just block the right side of your nose, so only the left side is open. Okay? I'm going to open this jar, and I'm going to have you smell this scent, okay? All right. You you could just take a little smell of that. Okay, and what is that smell? Cinnamon. Very good. Okay. I'm gonna grab another one, and if you could just switch sides of your nose. Okay, and I'm just going to hold this up to your nose. What does that smell like? Good. It smells like a lemon. Very good. Okay, and we're going to take one last smell, but I'm going to have you keep both sides of your nostrils uncovered, okay? Keep your eyes closed. And if you could just smell this for me. Yep, just take a nice smell. What does that smell like? Like mint, like peppermint. Very good. Okay. So I'm just going to mark off that your olfactory nerve is intact. And now let's go ahead and move on to cranial nerve number 2, which is your optic nerve. Now I'm going to bring out our Snellen chart here, and I'm going to have you read off some letters for me. So we'll start here at the top. What is this letter? This letter. Good. And what about this line? Can you read this line for me? Good. And what about this line? Can you read this line for me? Good. And let's move down. Can you read this line for me? Good. Let's do this one backwards. Can you read this line? Good. And what about this one? Very good. Okay. And what about this one? Can you read this? Good. And let's try this one. Can you read this one backwards? Okay, and let's do this last one right here. Can you read this one? Very good. Very good. So I'm going to put our Snellen chart back. And now I want to test your visual fields, your peripheral vision, okay? So I'm going to have you cover, let's go with this eye, okay? So if you could cover that eye, and I'll do the same, all right? I want you to tell me when you see my fingers come into view and when they disappear, okay? Good. Okay. Good. Okay. Good. Okay. Good. Okay. And now if you just want to switch eyes for me, okay? Just tell me when you see my fingers and when they disappear. Good. Okay. Good. Okay. the optic nerve looks great. So now we're going to be testing cranial nerves number 3, 4, and 6. These all govern eye movement. So you have your oculomotor, your trochlear, and your abducens. So have you had any problems with your eyelids drooping at all? Okay, I'm just going to take a little bit of a closer look here, okay? Alright, I'm not seeing any signs of ptosis, so that's good. That's good, okay? So now I'm going to have you focus your eyes on this point right here on the tip of my pen, and I'm going to have you follow it, okay? Using only your eyes without moving your head, all right? So just follow the tip of the pen. Follow the pen. Follow the pen. Follow the pen. Very good. Using only your eyes without moving your head. Okay. Very good. Follow it as best as you can. Let's go diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Okay, keep following this, and I'm just going to have you look up, down, up, and down. Okay, very good. You can go ahead and look wherever you'd like. All right, very good. Okay. All right, so we're going to go ahead and test your cranial nerve number 5, which is the trigeminal nerve. So I have a cotton bud and I have a toothpick, and we're going to play a little game called soft or sharp, okay? So I'm just going to touch you with the Q-tip or the toothpick, and I want you to tell me whether it is soft or sharp, okay? So this is just to a little point. It's not going to hurt or break the skin, okay? So before I touch you, I would like to ask if that's okay with you. Do I have your consent to touch you? Okay, we've gone through the whole exam so far without it being a problem, so I just wanted to check. So I'm just going to have you close your eyes, right? And this is what the soft feels like, okay? And this is what the sharp feels like. All right? Okay. All right, keep your eyes closed. Soft, sharp, 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 soft, soft. Very good. That's excellent. You can go ahead and open your eyes. Right. And now I would just like to test your masseter and your temporalis muscle a little bit. So I'm going to have you clench your jaw, open your jaw. I'll tell you what I need you to do, but I'm just going to be touching firstly this area of your face and then this one, okay? So I'm just going to palpate your masseter muscle here. Could you clench your jaw for me? Unclench. Clench your jaw. Unclench. And open your mouth. Close your mouth. Open. Close. Good. And I'm just going to do that, but I'm going to be palpating your temporalis muscle here. You could just clench your jaw. Unclench. Clench. Unclench. Okay, and open your mouth. Close your mouth. Open your mouth. Close your mouth. Okay, very good. That all felt normal. Right? So for your facial nerve, that's cranial nerve number 7, I'm going to have you do a few different commands for me, okay? You could just open your mouth for me and show me your teeth, okay? Very good. And can you close your eyes real tight for me? Very good. Okay. Now for cranial nerve number 8, I'm going to perform one test with you now and another test for that we'll do a little later, okay? So I'm going to be testing your hearing with a tuning fork, okay? So I'm going to strike the tuning fork and I want you to let me know whether you hear it more on the right side or the left side, okay? All right. All right, close your eyes for me. Okay. Good. Mm-hmm. Perfect. Okay. Good. Mm-hmm. Very good. So for the other test, we like to test your balance for cranial nerve number 8. However, I'm going to have you walk around the room and whatnot and do some tests with that later on. So we'll test your balance when we have you already up and moving, okay? Okay. All right. So next, I want to test your glossopharyngeal nerve, okay? So I'm going to have you take a swallow for me, okay? Very good, and that also tests cranial nerve number 10. And there's my pen light. Okay, so now I'm going to have you open your mouth, and I'm going to put this big tongue depressor on your tongue, and I'm going to check your uvula with a little pen light, okay? All right, so if you could just open your mouth. Very good, and all right. Would you mind saying ah for me? Uh-huh. Very good. Okay. All right, that looks great. So that goes in the bin. Alrighty. So cranial nerve number 9 and 10 we knocked out with one fell swoop. Okay, And now to test your accessory nerve, I want you to shrug your shoulders for me. Yep, just a nice little shrug. Just like that. Okay? And now if you could stick out your tongue for me. Okay? Can you move it to one side? The other? Up? And down? Okay, you can put your tongue back in your mouth. So that completes cranial nerve number 12, the hypoglossal nerve, and that completes our cranial nerve test. So now we'll get into the motor nerves, the sensory nerves, some coordination, and a couple other things, okay? All right, so for your motor nerves, the things that make your arms and legs go, right, that makes everything move, I just want to check around your limbs for any muscle wasting, okay, any atrophy. Have you had any problems with any of your limbs at all? Okay, so I'm just going to just very generally look at each arm. Okay, and then at the legs here. Okay, so the muscle condition looks really good. So now I'm going to test your muscle strength. I'm going to have you perform some different exercises, different tests with me, okay? So if you could just firstly hold on to my fingers and squeeze, okay? Very good. And now I'm going to have you put your arms up like this. I'm going to push against you. I want you to resist me, all right? Okay, and now I'm going to try to pull you, and I want you to resist me. Very good. Now I'm going to move to your legs. So with your legs, I'm going to put my hands on top of your thighs. I'm going to try to push them down. I want you to push them up, okay? Very good. And now I'm just going to try to pull your lower legs towards me. I want you to resist me. Okay, and now I'm going to try to push your legs towards you. I want you to resist me. Very good. Okay. So the motor nerves look great. Now we're going to test your sensory nerves. So we are going to do the soft, sharp test on your arms, legs, hands, and feet, okay? So I'm going to have you close your eyes again. And I'm going to just show you what the soft sensation feels like on your arm. That, okay, that's soft. And then the sharp is like this. Okay, so now on either your hands or your arms, I'm going to either use the soft or sharp tool. I want you to let me know whether the sensation was soft or sharp, all right? Okay. Soft, sharp, sharp, soft, sharp, soft, soft, sharp. Very good. And now I'm going to do that with your legs and feet, okay? So on your legs here, I'm just going to show you what the soft feels like. Okay, and now the sharp. All right, so you felt those? Okay, now if you could just tell me whether you feel the sensation of soft or sharp. Soft, sharp, 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 soft, 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 sharp. Very good. Okay, so now I'm going to test vibration sense on your extremities, okay? So I'm going to strike the tuning fork and I want you to let me know if you can feel the vibration where I place it, okay? You don't have to have your eyes closed for this one. Just tell me if you feel the vibration. Feel that? Okay. How about that? Right? Okay. Very good. Now on your legs and feet. Feel that? Okay. About that? Feel that? Good. How about that? Okay. Very good. Alright, so now we're going to test position sense, okay? So I am going to be taking either your finger or your toe, and I'm going to move it either up or down. And I want you to let me know what position your phalange is in, okay? So if I could just take one of your fingers here. Okay, so this is up and this is down, okay? So close your eyes for me. I want you to tell me if your finger is in an up position or down. Up, down, down, up, okay? Other hand. Up, up, down, up, right? And I'm going to do that on your toes. So this toe right here, if I pull it up, this is what it feels like. And if I push it down, this is what it feels like, okay? So keep your eyes closed and just tell me what position your toes in. Okay? Up, 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 down. Good. The other side. Down, up, down, up. Okay, very good. All right. So now I'm going to test the reflexes in your arms and your legs. I'm going to use this reflex hammer right here. First, I'm going to test the biceps reflex. I'll have you just relax your arms in front of you, okay? All right. And I'm just going to put my hand around your elbow and one thumb on the crook of your elbow, okay? And just keep your arms relaxed. Good. And the other side. Now hold your elbow and keep one finger in the crook of your elbow. Good. And now I'm going to test your triceps reflex. So I'm just going to take your arm and I'm going to pull it up here. I want you to let me take the weight of it. Good. Just let it rest heavy. Okay. Now I'm just going to put that arm down. And we're going to move the other arm up. Okay. Very good. And let that rest down. Okay, now let's go ahead and test the knee jerk reflex, okay? So just let your legs relax. Good. Any other? Very good. And I'm going to test your Achilles tendon reflex, so keep your legs relaxed. Okay. Good. And lastly, we're going to test Babinski's reflex. So I'm just going to stroke this along your sole of your foot, okay? Just keep your feet relaxed. Good. Very good. Okay. That one's a bit of an odd feeling one, I know. All right, now we're going to be moving on to the coordination part of our assessment. All right, so first, I'm going to have you touch your nose, okay? And then touch my finger here, okay? So just back and forth like this. Okay, you do that for me? Just touch your nose, touch the finger. Good. And can you do that as fast as you can? Okay? Yep, so back, forth, just like that. Okay? Very good. All right, you can go ahead and stop. Now, can you touch your finger to your nose again? Okay, and take it off. Close your eyes and touch your finger to your nose. Okay, and you can take it off. All right, so now we're going to be having you get up and do a couple of tests, okay? So we're testing your balance and your coordination here, all right? So as I said before when we were testing your cranial nerves, one of your nerves, we wouldn't do the second test until you're already up and moving. So that's part of this, okay? So if you could get up for me, and I want you to stretch out your arms, okay, out to your sides, okay? And if you could close your eyes and start walking forward. If you happen to run in or are about to run into anything, I'll let you know, but I'll make sure that you don't fall, okay? So if you could just start walking forward. Okay, you can stop and you can close or open your eyes, okay? All right, if you could just finish walking to the end of the room, you can put your arms down. And then if you could come back. Good. All right. So now I'm going to have you sit down and we're just going to sit for a minute, okay? I want to test your blood pressure when you're sitting and then when you stand up, okay? All right. So while we're waiting for your blood pressure to settle down a bit, I'm just going to continue a few notes. We are almost finished with the examination. We're just testing your autonomic nervous system, which is going to be with the blood pressure. And then I'll test your blood flow real quick. Won't take too long. And then we'll be all finished, okay? All right. Probably gotten tired of seeing this face for so long, huh? Okay. So now let's go ahead and do that test. So I have our sphygmomanometer here and my stethoscope. And do you have any preference as to which arm I put the blood pressure cuff on? Okay. So I tend to favor this side, okay? Okay. I've got the stethoscope right there. We have the dial and... Okay, so I'm just going to inflate the cuff. Okay, I'll let all the air out. And I'm going to keep the cuff on your arm, and I'm going to have you stand up for me, okay? Just like that. And I'm going to measure your blood pressure again. All right, and then we'll let that out. Okay. You can go ahead and sit down. Okay, there doesn't seem to be any problem there, which is really good. So now I'm going to listen to the blood flow in your carotid arteries here, okay? So I'm just going to be putting the stethoscope on your neck, okay? So I'm going to have you take a deep breath in for me. And hold it. Okay, and exhale. And the other side, deep breath in. And hold it. And exhale. Very good. So I didn't hear any bruise in your carotid arteries, which is good. You don't have to worry about the blood flow to your brain. So that is going to conclude our neurological assessment today, all right? Do you have any questions for me? Any concerns at all? Okay, you passed with flying colors. I didn't see anything that we need to follow up about or monitor, okay? So I'm just going to sign off on this. Okay, and that will end our session today, okay? Thank you so much for coming into this clinic and having your neurological assessment with me today. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.